To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Today I'm joined by Dr. Chris from the Wisconsin Tongue Tie Institute inside De Pere Smiles. Hey Dr. Chris.
Hey, how are you doing?
I'm doing great because you're here. You know, I didn't know how prevalent tongue tie was until we started talking. So if you're a parent or a grandparent, is there a visible sign that you know that's a problem, or is it more behavior?
Yeah, let me just start off by saying we all have a strand of tissue that connects our tongue to the floor of the mouth called a frenum or a frenulum. We want to make sure that it's not a problem. A lot of times function follows form, so if it looks like that's right to the tip of the tongue, a lot of times things aren't going to be working appropriately. However, a full functional assessment is what's needed to figure out, is that frenum a problem?
Yeah, if I don't pick up on that right away, what would some of the things the infant, the baby, be doing that might lead me to think about it?
When we have little infants in the office, we want to make sure that they're able to feed appropriately without swallowing a ton of air. And if the tongue cannot elevate, we're going to break suction, we're going to click, we're going to leak milk. A lot of times moms are in pain if they're breastfeeding, and then we got a really gassy, fussy, colicky infant that spits up a lot just because they're swallowing too much air.
Yeah, and then nobody sleeps, which
Exactly.
we don't like.
No.
So what happens if I don't pick up on these signs, left untreated in an infant?
We always say that problems just get bigger and harder to fix. When we got an infant, it's one thing to potentially do a procedure and move on and feed appropriately and have proper growth and development. But if we have an older child, a 2-year-old or a 5-year-old or even an adult that's left untreated, we see orthodontic issues, we see speech and eating solid food issues, and then we got to go through therapy to make sure that we remove the compensations that have been formed.
So as soon as we have an inkling something going on, the better, even if it's an infant.
Absolutely, sooner the better. We did one this week that was less than 48 hours old.
Wow, okay. So let's talk about that. The process, we as parents were a little guarded. How easy is the process to get it fixed?
Yeah, so like I said, we come in, the lactation consultants that we have will do a full feeding assessment, which is awesome. They're a wealth of knowledge. They're going to educate the parents, and then I'm going to come in and I'm going to educate the parents on what we're going to be looking for. We'll take a look together, we'll come up with a plan, and then if we figure out that we're going to be doing something, we're talking 30 seconds or less of a lasering procedure with our CO2 laser. So we borrow the baby for a couple minutes and that's it.
Oh, pretty easy. What got you into this, Dr. Chris?
My oldest daughter, honestly. I always tell her she gets all the credit for it. She's 8 years old now, but when she was an infant, we had a little bit of difficulty feeding, gassiness, fussiness, and we got things fixed, tongue tie, and 8 years later, here we are.
Yeah, amazing, amazing. Well, Dr. Chris, thanks for being here today and kind of educating us on what to look for tongue tie. And we want to thank you for watching To Your Health.
The preceding was a paid advertisement.